Okay, good evening, everybody. Welcome to this evening's Health, Housing and Adult Social Care Scrutiny Committee. My name's Councillor Burton. I'm chair of the committee tonight. First on the agenda, we have apologies. We have apologies from Councillor Moroney, who is being subbed by Councillor Conrad Whitcroft. And then we've got Councillor Myers and Councillor Taylor is subbing for him. So thank you both. Have we got any declarations of interest? No. I have a declaration of interest because I use Be Independent. And I know they're mentioned in the report, but I don't think that will be a problem. Okay. Has everybody had a chance to read the minutes of the meeting of the 11th of September? And has anybody got any points to raise? Yes, Councillor Smalley.
Yeah, it's not really a bit about, well, it's on the minutes in terms of it was a resolution. And I'm aware it's not been that long since our last meeting, but obviously one of the resolutions was to write to the relevant government minister. I just wondered if that's happened.
No, it hasn't. I have actually been ill for the past 2 weeks, so apologies. And I'm still not 100%, so bear with me.
It's not been.
But I'll put that on my urgent to-do list.
Thank you, Chair.
Thank you for that. But apart from that, everybody's happy with the minutes. Good. Thank you. There's no public participation tonight. We have an awful lot of speakers here with us, though. I think we're about equal in number. So the first thing on our agenda is item 4, and it's Finance and Performance Monitor 24-25 Monitor 1. And we've got Patrick Looker, Stephen Tate, and their service heads of finance, head of finance and finance manager. So welcome.
Thank you, Chair. So the report presented to the committee covers the Monitor 1 Finance and Performance Report for Health, Housing and Adult Social Care Service areas. It uses extracts of data that was considered by the Executive last month, 12th September 2024. The report provides members with details of the overall financial position of the Council, which is reporting a projected overspend of 3.4 million at the time. That's obviously a significant improvement of the 11.4 million we were reporting at the same time last year, but the level of overspend is still significant compared to the Council's overall council reserves, so we do need to look at mitigating that overspend down through the year. Regarding the overall council position, the continuing trends of overspend or service pressures across primarily social care services, that's children's and adults, offset by savings across other services. And from paragraph 13 in the report, you'll see more detailed analysis of the financial position across adult social care and housing services. We've included the outturn in the far left column, which can be compared to the current forecast. And from paragraph 48, the business intelligence team have identified performance scorecards relating to the council plan. The full set of indicators across the scrutiny remit are also provided at Annex 1. So we ask you to consider the report, see what questions we'll be able to answer around the table in terms of adult social care director and this is Michael Colbert, director is within the room. I'll answer some housing questions if they relate to homelessness, dens, Southall's in the room to support as well. But there might be some areas where we don't actually have service staff who are able to do, but we'll take those questions away and get back to you.
Okay, thank you very much indeed. I'm sorry, Sarah. I'm sorry, I didn't think you were coming tonight, so welcome. Oh. I didn't realise you were going to be at the table, so sorry about that. Thank you.
Yeah, I just had something, Chair. So I'm Stephen Taylor. I'm just point out There's no public health finance information in because there was no major variations expected at Q1, so that's why members haven't seen that.
Sorry, I missed that actually.
So the public health information isn't in the report in terms of finance because there's no variations at the Q1
Okay,
or no significant variations to
Okay.
report.
thank you. Thank you. So, any questions, councillor Taylor?
Thanks, Chair. It's a pain having laptops around the table and then moving your microphone around it. I think first thing to say is hats off to everyone involved in trying to deal with the financial challenge. Sort of great progress has been made there, and it's probably an extremely difficult set of circumstances. I know we're not there yet, and local government funding is a car crash at the minute, but it looks like you're doing your best, so hats off to you. I've got a question relating to paragraph 16, which is regarding how the council receives requests from providers for higher rates of inflation than have currently been agreed, and how this is a bit of a challenge because it needs balancing against the risk of provider failure / withdrawal. How often does that conversation come about, and have we had any cases of providers failing or threatening to? Because I mean, I read that and my initial thought is, well, and this goes beyond the council, it is a national thing. No provider has an automatic right to exist. And if the market isn't doing the job, then there's a bigger question that we need to solve as a nation. But that's quite deep. But on a very local level, how often does this kind of conversation happen? And have any providers folded, withdrawn?
Thank you. So I guess the first point to note is these are primarily providers of care and support services that we're talking about, primarily registered care providers. And under the Care Act, we've got a statutory responsibility to respond in respect of provider failure. So if a provider that's a registered provider sees us operating in our area, we have a responsibility to pick up meeting the care and support needs of all of the people that provider supports, regardless of whether they meet eligibility criteria or whether they are self-funders. So we do have that additional responsibility over and above eligible, the responsibility to meet needs where people are eligible. We also have responsibilities under the Care Act for market management. So we do need to steer, shape and manage the market. We should also signal the market in terms of our strategic intentions. And part of that responsibility, which mainly is fulfilled through our commissioning team, but obviously with, very heavily supported by our adult social care, social work assessment staff and teams, is to make sure that we have sufficiency of resources, support in our area to meet the needs of the local population. And again, that's not just people that are eligible for support from the council or funding from the council. That's making sure that we can consider the needs of our overall population. So although, the point about no business, has to exist, actually, we've got some additional responsibilities in terms of those care providers if something bad happens. So if a provider can fail for a number of reasons, sometimes that could be related to quality concerns where the Care Quality Commission or perhaps the fire service or environmental health have identified issues to do with the quality of delivery, and the CQC ultimately can apply sanctions that ultimately could result in the closure of a service. Again, we would pick up initially the responsibilities to those people supported. If that was a care home, for example, we might have to find alternative places for people. If it was a domiciliary provider, we would have to meet those needs through commissioning or providing that support. And then financial failure or risk of financial failure is something that unfortunately has become more frequent nationally over the last, decade. So it does happen that providers are sometimes not able to manage to operate in a financially resilient way. And again, if they indicate that to us, sometimes that can happen quite slowly over a period of time, and you have a planned withdrawal from that service, and you can work with people in a planned and proactive way to move people on. Sometimes there can be some quite sudden failures of providers. Now we haven't had any significant failures in York recently, so certainly not in the 6 months that I've been in post. And I can't really share details of individual providers and some of the conversations that we've had, because it's commercially sensitive information and we would need to seek permission to share some of that detail. But what I can say is that we have had providers who've approached us indicating very significant concern about finances and suggesting that they may need to close or change or reduce their business if the fee rates they receive aren't increased. So again, in some circumstances, it's a balance. So we would assess the overall sufficiency in the market. For example, if Care Home X closed, would there be enough beds for us to recommission those for people? We would need to think about the impact on individuals. If that happens, somebody could have lived in a particular place or received support for a really long time. That could be really distressing for somebody if that provision closed. But we also obviously have to balance that with our best value duty and making sure that we, clearly we can't just continue to give any increase that people request. So we will look at things like benchmarking. We'll look at, how our fee rates might compare to comparator authority areas. We'll look at the national living wage and how that's changed. We'll look at inflation, and we'll ask providers to, if you like, open their books to us so we can consider, the evidence base beneath what they're asking for. Okay.
Unless anyone's got any supplementaries on that. Yeah, so that a lot of that was about how much we're in control of our finances, and I guess most of my questions around finance relate to the same thing when we're talking about health and adult social care. Page whatever page we're on, page 6, para 13, which is the table of finances last year versus this year. I guess the two questions that spring to mind are: last year we've got the outturn, the plus several £million across those top 4 rows, and then this year we've also got the additional 1 mil for direct payments, 2 mil for supported living. Did we bake in that as the outturn? Did we increase our budget this year by that amount, expecting it to be carried over? Or did we estimate this year's budget based on other numbers? I'm thinking that home and day support, for example, is £1.8 million extra last year. It's only budgeted for 1.2 this year. I don't know if that's a bit of a financing number question.
Yeah, so I mean, Steve could give you more detail, but so we did receive some precious funding, but I think at the moment the estimation is it probably wasn't sufficient to cover the pressures that we're seeing in year. And part of the challenge that we have is with savings delivery has not necessarily been delivered effectively, and those savings have come out of the budget in previous years. We've also seen pressures in previous years that we won't, it's hard to unpick, to be honest, but I think the straight answer is we've not got sufficient precious funding to cover off all of the pressures we're seeing. But the majority of councils in the country are forecasting to overspend on adult social care this year as they have in previous years. So this is not a dynamic that's unique to York, unfortunately.
No,
anything to add, Steve?
Just in terms of the table, the budget line 1.234 for home and day support, we overspent by 1.8 million last year. We're only forecasting to overspend by 61,000 this year. So I didn't know if that was clear to people. So we did try and rebase with the growth we got, because we got several £1 million worth of growth in adult social care in this financial year. So rebased where we could, where we left the pressures of where we thought we could maybe do something about it. And supported living, in the past we benchmarked that against other areas. We know we're a high spender in that area. Direct payments, we've got more ability to recover unused funds in that area. So we took a calculated decision to leave the overspending areas where we thought we might be able to do something about it.
Yeah, I guess my question wasn't clear on what I meant it to mean, as it were. So I'm taking your point fully on board. There's the other row, which is 11 million. We're off by 100k. That's, you know, great forecasting, great budgeting. The home and day support is, you know, if it was over by 1.8 mil last year, but we're on track for 1.2 mil this year. Obviously, we haven't budgeted, taking into consideration everything last year, and assumed it will continue. So for the direct payment supported living in particular, where we're 3 mil over, was that because we did build all of last year's overspend into this year and we're overspending again? It's getting worse and worse year on year. It's snowballing in the case of, you know, supported living, which is even greater than last year's overspend. Or is it because we were really optimistic and we didn't include the stuff from last year, hoping that we wouldn't see the same thing happen again? What's the reasoning behind those two rows in particular?
Direct payments has improved in terms of the outturn versus where we are now. The thing that's probably a bit peculiar around supported living was we gave a mid-year uplift last year that was funded by some uncommitted grant, and we've got the full year effect of that in this year, and that arose probably around October, November, December time. So it was really quite late on in the budget process to start building in that growth. The other thing that would have happened is we'd have had to make more savings to afford that growth, because obviously we've got to balance it across the piece.
That makes sense, I guess. If we knew about it tail end of last calendar year, we probably should have had it in this year's budget. Conversation another time, but it answers my question. Thank you.
Brilliant. Thank you very much, Chair. I guess a couple of questions. Firstly, I was trying to find, I guess, how much the overspend on bad debt sort of currently is. I guess legacy debts that haven't been recovered for sort of more than 6 months, more than 12 months, etc. I'm aware in some authorities that is a really significant and crippling cost. But I couldn't find it within the paper. And I guess secondly, I guess what's being done, or what opportunities might there be to recover some of these overspends by sort of basically getting other agencies to contribute to them? So I guess one thing that stands out is the hospital discharge team. Now, I'm not, I guess, fully aware in terms of how that's funded currently, but I'm aware in other authorities with adult social care responsibilities, overspends and teams such as that are sort of, yeah, hospital trusts, for instance, sort of bear some of that overspend liability. So I guess those two questions on bad debt, and then trying to recover some of those overspends using other agencies. So they have a significantly larger budget than we do.
In terms of things like the hospital discharge team, we do maximise income, particularly from health funding. So there have been some additional pots of health funding over the last couple of years where we've got our fair share. So there's things like the Ask Discharge Fund, where I think we've got probably about £600,000 of that in terms of what health had to play with and what we've used to support the discharge of people. The Better Care Fund is used significantly as a pool budget to support some of these things. So a lot of the hospital team, as you've described, is supported through that Better Care Fund. But the hospital discharge team are the ones that are at the sharp end of the problems in the hospital. And you're obviously aware that health organisations are also in severe financial straits as well. So that's my answer on that. We don't take the bad debts.
So can I just add to that, if that's all right, briefly? So one of the areas that we are progressing this year is supporting integration and thinking about how we can integrate or jointly commission, how we can potentially bring some of our teams together to work differently. So you might be aware there's some work to consider an integrated commissioning approach that sort of expands the Better Care Fund, if you like, in terms of a larger Section 75 agreement, and there may well be opportunities within that for us to just, you know, make best use of the York pound and think about that rather than kind of spending individual pots of money on potentially duplicated areas. So I think there are opportunities for us to make some efficiencies and some support there. I think the majority of the staffing that you're referring to is probably already funded from BCF, but I think also there's you know, there's opportunities for us to consider, you know, where we've got duplication of not just, you know, operational practice and frontline practice, but commissioning and administrative resource and support services. for some of those teams and services to think about how we might do something differently. It's probably unlikely we're going to see benefit from that in year. But I think we do have opportunities, I think, to think through what we could do in that space to support us next year and in future years.
Just in terms of bad debts, assuming you're talking housing rents.
Care.
All right. So in terms of housing rents, arrears have been broadly flat for around the last year. So we've been doing a lot of work in terms of making sure that tenants aren't getting into further arrears and dealing with plans. So it looks like at the end of last financial year, about 2.2 million of current tenants arrears. That's about £100,000 more than it was in the previous year. But based on a rent roll of over £30 million, it's sort of it's a significant sum, but it's kind of manageable within the current levels of the working that's going on within the HRA. Most of the work is actually done by, or the initial work is done through the housing team, because they effectively know who the tenants are. They have build up the relationships, they understand the issues that are going on, rather than going through quite so much of the sort of debt collection service that we provide. But obviously we do go through those services where rents aren't being collected.
If I could, Chair, I guess on responding on both, and then I'll shut up. On the hospital discharge team, I mean, I don't know how much, I guess, of that 316k overspend in staffing is that team, but I guess that's lumped in within the mental health advocacy team, social work team, etc. But in principle, and it does happen in other authorities, that where those teams are funded by BCF or combined authority in other areas, that overspends are sort of, it's recognised that that should be, the burden shouldn't just fall on the local authority. The saving from having a hospital discharge team does not save City of York Council that much money. The saving is within acute and within hospitals. So I guess it's making sure that those organisations that see the benefit of that, take as much sort of liability or their share as possible. And then, no, I guess the bad debt I was referring to really was in domiciliary care. In some authorities, it runs into several £100,000.
So again, the assessment of people when they've been in hospital for social care needs against eligibility under the Care Act is a council's duty and responsibility. That's the starting point. I've worked in 4 other councils, and yes, I'm aware that there's been various different funding methods and mechanisms for most of the social care teams, and there are potentially opportunities to talk to our acute trusts about that. I think, given what we know about the state of the trust's finances and the ICB finances, it's probably more likely that resources will reduce than they will increase. But again, I'm the senior responsible officer for a piece of work on behalf of the ICB, which is to look at developing integrated or multidisciplinary integrated discharge hubs. So that won't just be for York, that's kind of looking across the whole area. And again, part of that discussion is where we've got sort of multiple organisations represented and line managed. If we kind of create a situation where we've got one, multidisciplinary integrated team with one jointly trusted and empowered lead for that team and service, we could potentially need less resource overall, and we could see a situation actually where we see better outcomes for people, which would be fantastic. So I think within it, I'm not sure it's an effective strategy to manage our overspend by asking other people to pay for it. I mean, we can ask, absolutely. I think the most effective strategy from my perspective and my experience is to say, here's what we all spend. How can we reduce the overall financial envelope there? And how do we work together to achieve that? And I think that applies in a number of circumstances, continuing healthcare, mental health, aftercare services. There's lots of areas where we jointly fund or we work in the same space, where if we did things differently, that might allow us to collectively spend less. Yes, the benefit of hospital discharge it might feel like it's for the hospital, really it's for people, because we get people home to the right place as soon as we can. And that, again, that's our responsibility and our duty. How quickly we do that and how effectively we do that absolutely will impact on the trust performance. But the people we're talking about are people in York, they're your constituents. We really want them to get home and be healthy and looked after and supported. So we would want to do that, I think, even if it wasn't a responsibility. But I'm not, apologies, but I think the important thing is about how we go about doing that in partnership. And I can see that there's work for us to do, and I can see that there's a long way to go in York compared to some other systems and areas. And I think we can absolutely work on some of that sort of collective flow towards those better outcomes for our York people. Is that right?
Yeah, very good. Supplementary, okay.
Sorry, I just realised that the debt, I think you're talking about income from citizens through fairer charging. I don't know is the answer to that, but we can seek a profile for the, do you know, Steve?
No, I was about to say the same. I'll go away and find out,
But
see
you're
what
right.
they're doing about people that suffer.
Yeah, sometimes we have a profile of unpaid debts or uncollected charges. We can check where that's at and our strategy and approach for how we work with people in terms of collection. It should be slightly different to how we go about collecting debts from, people, perhaps other bits of the council, but we can have a look at that. Thank you. We'll take that one away.
Okay, the supplementary for Councillor Whitcroft.
Yeah, thank you. Just on that same theme, when it comes to the whole financial envelope and the amount that everyone is spending on this, there's a relatively new player in town, which is the combined authority. I just want to understand, have you had any sort of, to what extent have you been engaging with the combined authority in this area? How's it been going so far? And is there anything that I guess we can do to sort of help with the improvement there?
I think we've had some initial conversations through colleagues within CMT about what areas, are obviously priorities for the combined authority that will also be priorities for us as a council and for adult social care particularly. I think there are some that align. I think, I'm going to introduce the draft homelessness strategy in a moment as well, because I've been doing some work as part of that with housing colleagues. There's a saying that there's no decision about care that's not also a decision about housing. So if we've not got the right roof over someone's head, with the right support in place, we can really struggle to do what we need to do. There's those links there, I think, in terms of the priorities around housing, accessible homes for life, making sure that we've got the right support. So I guess an early example of that is you might have seen a paper that came to executive quite recently that outlined plans for Lowfield Plot A, which is a plan to build some supported living accommodation, which will be potentially for people with learning disabilities or autism and or mental ill health. And we've got some funding through the combined authority for sort of initial developments of that. So that's a really great example of how we think we could work together. I guess the other areas might be around workforce, education and skills, training and development, thinking about how we support people to get into health and social care as a job, so that we can, again, keep people in the area and make sure that we've got really good career pathways for people. So there's lots of links there that I think we can investigate. Yeah, thank you.
Okay, thank you. Councillor Batsey.
Thank you, Chair. My questions are in two bits, so I'll do the first broad brush thing first. So I was interested in paragraph 13 and 15, just on understanding some of the figures there. So firstly, why has there been a huge increase in spending at Be Independent? Is that all related to equipment or something else? And secondly, in that, what does the word other mean in that chart? Could you just expand that a bit so that we understand what that's about? And in para 15, again, broad brush stuff, social services received an extra 7 million, you've said, for 24-25. The paragraph then accounts for 3.2 million. What about the other 3.8 million? What's happening to that? How does that relate to this large figure?
So the 3.8 million was what we did to try and rebase some of the budget. So that's why you'll see on the table above the home and day support overspend coming down significantly. Similarly with residential care, so that 3.8 is a mistake. We should have included that, to include that was in the statement to make it as clear as possible. So that has been used to take away some of the pressures that have bled through. I think being independent is a bit more complicated, so we're aware, probably most people around the table, that was a community interest company at one point in time and was struggling financially, and so we brought it back in-house. So it came in with certain financial problems that haven't really been addressed in the period it's been back in-house. When it came back in-house, we what's the word when you put things together? Consolidated, that's the word, yeah. Some of the staffing onto the council's terms and conditions. So you've seen a bit of that in there. When Be Independent first went out as a community interest company, there was an expectation that that would deliver to an extra 25% of customer base. When it came back in, that hadn't materialised, and the customer base has slowly, it's plateaued a little bit, but it's not going up in the way we'd want to support people to keep them independent. So they're the main reasons for being independent and the overspend, and where the 3.8 is shown in the table above.
Thank you. And then the word other in that chart.
Other, it's a big credit. So we get an adult social care grant into the council. So what you could do is you could pro rata it across all the budgets, but would you keep it in one place? And that's why you've got a big £10 million budget on there.
Right, thank you. Yeah, I think given that these are public documents, I think it would be helpful going forwards if there was some explanation there, because it just feels like a nebulous blob of something that isn't tangible. So in future reports, I'd certainly recommend that there was a bit more clarity. My other point, if I may, Chair, relates to I suppose broadly paragraphs 18 and 22 and paragraph 9. So in paragraph 9, it says it's recognised this will require difficult decisions to be made to protect services for vulnerable residents. And I know that all of us around the table want to see that. So my concern relates to an issue that's been around for a little bit about the York Age UK Day Clubs. And I'm struggling to see how the difficult decisions are working to protect those vulnerable residents. And I've been speaking with people at York Age UK, and I thought it would be helpful to maybe give some information that would add light on what we heard at full council. So we heard at full council that attendance wasn't very good, and people considered the price of a day at the day club to be high. And I've had a conversation about that, and I think there are two really important things that need to be said here. First of all, the day clubs are not all about people with dementia. 180 places of people who are not having dementia, but have isolation and loneliness issues that are critical to their well-being. And we know elsewhere, the reablement plan and all sorts of other things in here, that we want to enable people to stay at home as long as they can, to be supported, and all these other things. It seems to me that not regarding those 180 people's, the risk of isolation and loneliness as being a key reason for keeping the day clubs going, I think I'm worried about that. And I wanted to make sure that we understood when it was said at full council, I think by Councillor Steels-Walshaw, but I may be wrong, that there was a relatively low attendance at these clubs. The point that has been made to me that I think I wanted to bring here, because I think it's really important, is there's no shortage of people who want to be on that programme and to be listed on those day clubs. The reason the attendance varies hugely is precisely because of the vulnerability of that group, the isolation, the loneliness, their health problems from week to week. So one week I'm told you could have 130 people attending, and the next week there would be just 90. And I think when we look at the value of the service and the number of people using it week by week, it's absolutely critical that we understand the nature of the users of that service. And I'm saying all of this because we've got a lot of talk here about protecting vulnerable residents. And I'd like to kind of have a sense whether you as a team have factored in the impact down the line of decisions like closing the day clubs on other parts of the service, on the reablement programme, on the Be Independent programme, on so on and so forth. How do you quantify and balance these impacts, I suppose is my question, in relation to the figures that we're getting here?
Okay. So you're referring to a decision that was made by full council prior to the start of the financial year in relation to a reduction to the community contracts budgets. So, I mean, we're probably not looking at last year's finances as part of this scrutiny discussion, but I understand the link that you're making in terms of the impact for vulnerable people. So that budget was reduced. That was a decision taken by the council, and part of the work that the commissioning team undertook, as I understand it, was to consider what areas could be reduced, what contracts are not meeting statutory duties, because obviously if a contract or service is meeting statutory responsibilities, we wouldn't be able to simply reduce it. And to look at what was contained within that overall, if you like, budget envelope in terms of the community contracts that we've got. Those decisions would also be hampered by the timescales for contracts and grants when they're coming due. So I think all of those things together gave very limited opportunities in terms of where those savings could be found. So the majority of the contracts that sit in that that are funded from that particular budget are meeting statutory responsibilities. The Age UK day clubs are not. If we consider the impact for vulnerable people, one might argue that where we've got a statutory duty to meet the needs of people who have eligible needs under the Care Act, they're probably by definition more vulnerable than people who don't. I think there is a really important consideration about understanding the impact of perhaps thinking about what is funded and from where in terms of that community space, and how we can work with organisations like Age UK to support them perhaps to think about different ways of operating and how they run their businesses. So I know that they're working, and I've had an update from them today actually, so they are looking at delivering 4 half-day clubs from November. They're going to be looking at about 60 places initially in those sessions, and that would be, you know, they would be in addition to the services that we do directly fund in partnership with the ICB. So they are, it looks like, able to think about offering some replacements, and they've been able to think through a reasonable charging profile for those. So that does mean that some of those non-statutory services that, you know, I'm sure are delivering really great, you know, services and experiences for people, some of those can continue and be delivered in that way. So it's not that we don't think they're important or they're not doing a good job. It's that they're not necessarily things that adult social care can fund, as well as all of the rest of the things that we need to fund from within our budgets. So where we have choices, if the choice is between meeting a statutory duty and not, we have to go with meeting the statutory duty. I appreciate it's really, really difficult when you see the impact for an elderly person who's been going to a club for a while. But we also have, you know, we've offered signposting and support to people, as well as asking Age UK to, you know, make sure that they can consider offering different opportunities to people who attend and signpost where possible. And anybody who's been attending those clubs who needs extra support, they can request a social care assessment. Age UK can support them to do that, as well as family members, and we will look to support them If they do have eligible needs, we'll find ways to meet those needs. If they don't, we can signpost, we can use services such as local area coordination and think through what's available to support people in terms of alternatives. I'm afraid there's rarely a good choice when it comes to cutting or reducing social care budgets. There's the least worst option. That's about as good as it gets sometimes, I'm afraid.
Thank you.
Can I
think
respond
just a minute, I think
before?
if you just hang on, I think Councillor Walshaw, Stephen Walshaw would like to respond.
Okay, I was just going to follow on from what Sarah just said about the decision to cut these services was an incredibly difficult decision to make. And since we have been focusing on issues around it not, sorry, there being no alternative, but there being alternatives elsewhere. And as Sarah said, looking at people who possibly would need an adult social care assessment, absolutely able to have one and look at their needs, and also working alongside local area coordinators as well to look at what's available in people's communities to get them involved with their communities. As I say, it was a difficult situation, but made under the guise that there was alternatives there in people's communities, and to look at and work with them and with Age UK within this to signpost people to alternatives and look at their needs.
And if I'm correct, none of the dementia clubs were cut.
No, they weren't.
I mean, I appreciate what you're saying there.
If I can just briefly respond, Chair. So I'm heartened to hear that you are still talking with Age UK. I've spoken with the organisation, and what really struck me was how positive and engaged and constructive they are. They are willing to try and find new and innovative ways of addressing the challenges they've had, of maybe charging differently, of working with volunteers differently while still keeping professional staff. I was impressed at how positive they were about moving forward. So I really hope that it's a good sign that you're talking about other things, and I hope that continues, and I look forward to seeing progress on that. On local area coordinators, I'd only say to you, Councillor Steele-Walshaw, that people in rural wards like mine and like Councillor Hooks, we don't have a local area coordinator. Some of the people who have been using the Age UK clubs come from rural areas, and actually finding out what's available and being put in touch with different people is incredibly difficult without those coordinators. But I'm glad to hear the comments you've made. Thank you.
Thank you very much. I think I had Councillor Whitcroft and then no? Oh, right, okay, so Councillor Rose and then Councillor
Yeah, it's just
Taylor.
a quick supplementary on that point, if that's all right. I think we've deviated from the topic of this meeting slightly, but I'd also like to reiterate the comment I made on Monday night scrutiny, which is it's very, very easy for us all to say, here's some more money I'd like you to spend. But what we've got in front of us, and there's lots of really good news stories in here, by the way, and numbers are a lot better than they were, and a lot of the metrics are a lot more positive as well. But we're sitting here with another £2.3 million of cuts to find, and I think it'd be really constructive if Scrutiny found more ways of saying, here's where we think you can save, than continually chipping away at the savings that have been made. In this particular case, something that people did have to pay to use and therefore wasn't available to the most vulnerable in society. But just wanted to make that point, because I think we're talking about the finances of the city, and we're talking about many millions of pounds, and that's a bit of conversation fixated on a very small amount of spend, even though I appreciate it's representative of wider constructs.
And I think it goes to say, with the last item on the agenda, looking at adult social care and its offer here, that they're also a very positive organisation, and they're dynamic, and they have a good team at the top, and I think, you know, that will hopefully balance some of these awful swingeing cuts that have had to be made. And I don't think any of us no one wanted to make cuts like this. But sorry, Councillor Taylor, sorry, I got carried away there.
It's all right, Chair. Thank you. I think I just want to say that I'd fully support what the director and the exec member have said, and I share Councillor Vassey's concerns, but I just find it difficult really to sit here and keep my mouth shut when a lot of his party's colleagues have been banging on about the green bin tax. Now, if this administration didn't introduce charges for that, then the types of cuts that we're all really uncomfortable with would be even worse. And we are in the territory of there are no good decisions, and it is very much least worst. And that's why we're trying to look across the board and look at things like green bins, which aren't statutory, because otherwise the situation would be far more worse. And I'm raising it because it's easy to sit in a meeting and cherry pick individual services and areas and not look at the bigger picture. I think we'd all be better off if we kept that bigger picture in mind when it comes to campaigns and political statements that we all make moving forward.
Last word from councillor Rose.
Just
We'll
to,
get
yeah,
that
my,
over.
my other question from the start, which I've been sat on, but is a housing question from this report, if I dare ask a question related to housing numbers. It's paragraph 69 on page 21. And the table there doesn't quite match the table in the footnote that it has 1.6%. In the paragraph 68, it talks about 1.9%. Relating to the percentage of dwellings failing to meet the decent home standard. I remember that Michael Pavlovic came to previous committee and warned that the number might go up, even though we were getting closer to zero, for the reasons outlined in paragraph 69, which is that we were doing a full extensive survey. It says 36% has been inspected, and that's obviously knocked it up from 1.6 to 1.9. I just wanted to get some idea of whether that is expected to be representative of the rest of the kind of the other 64% of stock, or if we think we've inspected the worst or the best. To what extent have we got more houses that don't meet the standard compared to what the numbers are saying in front of us?
Well, thank you for the question. I will take the fifth on that one and say, sorry, that's way outside my expertise, but I'll get Michael Jones, the head of housing asset management and delivery, who is leading on these surveys, to get a response back to the committee.
Or if the exec member happens to know the answer to the question. I don't know, Michael, if you happen to know if the standard of the 36% that we've inspected is likely to be representative of the rest of it or not. If not, that's fine.
Thank you, and thank you for the question, and thank you, Chair. The stock condition survey is now almost fully complete. So we're expecting that 36% to have increased because the survey started at the beginning of the year. So this is 2023-24. We're now into 24-25. So I'm expecting more issues to be identified as we have a more detailed analysis of the completeness of the stock.
Do you have any idea as to roughly where that 1.9% meeting standards is going to plateau out at a peak before it goes back down again, or is that
I can't. That analysis hasn't been completed yet. So the company that's doing the stock condition surveys will give us their detailed analysis. What they've done at the moment is identified issues that need emergency repairs, and those emergency repairs have taken place. What they will then do is give us a complete breakdown of the overall figures, the overall numbers that then aren't meeting the decent home standard. And of course, the decent home standard could be around having an electrical check done within the correct time frame. So that work hasn't been completed. When it has, I have asked the officers bring it to scrutiny, as well as bringing it to the executive. With obviously there'll be an action plan with a resource implication as to how we're going to then meet all those, all the work that needs to be done. So these are often historic problems that, because they haven't been addressed in previous years, we're now taking on.
Thank you. And yeah, I think if it comes back to scrutiny, we can talk about how we keep it as close to zero as possible going forwards. That'd be really good.
I mean, that's obviously the target. So to have already got down from 4.88 down to 1.6 was an example of the amount of work that has taken place. But it's going to continue to need investment and work to bring it down to as close as we can to zero.
Okay. I think one last question.
One quick observation, because it relates directly to something we raised. Quick observation, because it relates to a recommendation we made the last time these figures came to the meeting. We noted that the benchmarks on the charts more often than not say not available. And we asked if future reports could give us comparators so that we can actually look at this in the round, looking at other local authorities. And I'm afraid all the benchmarks are still saying not available. And when I look at, I can see, one about breastfeeding, comparing the richest and poorest wards in the city. Well, all local authorities have richest and poorest wards. There must surely be a way of finding a comparator. And the same with the housing, when it talks about percentage of dwellings with energy ratings in the A to C band. All local authorities must be collecting that kind of data. So I just again appeal that we get comparators to help us see how York performs in relation to other local authorities.
Councillor Papley.
There are a number of comparator authorities for different things. So you could incorporate Oxford for some areas, Cambridge for another, Chester for a third, Bath for a fourth, Tokyo. Yeah, sorry, it's rather facetious. No, it's which authority do you want to benchmark, or do you benchmark them all, then take an average, and then say that's your benchmark? That's not a benchmark. So there are some things that you just can't benchmark unless you want to pick an authority that you want to compare us for non-decent homes, and then we can put that to business intelligence.
Very quick.
Yeah, just to add on this specific one, they have included benchmarking data, 2.4% Yorkshire, 8.4% England versus our 1.6, 1.9. So it does show we're good against it. And there are a few in other paragraphs, and I think it is good that they've included them. There's more that we can do over time, but on that one, we've got a good benchmark.
Okay, great. Now I'm going to close it there. Our committee has been asked to note the finance and performance information. We've done that. We've interrogated what we've been given. Note that work will continue on identifying savings needed to fully mitigate the forecast overspend. And I think we can be assured that that's very much going on at the moment. So thank you very much for coming along tonight. And if we could have more comparators, there's so much the better. But I did notice there were comparators myself. So I didn't notice the ones that weren't there, but I did read it all. Thank you. So, moving on now to item 5 on the agenda. It's a report of the Corporate Director of Adult Social Care and Integration and the Director of Housing and Communities. And we've got here this evening Sarah Story, who you've already had a good grilling. I'm going to carry on. And thank you for being here. So, and also there's Professor Nicholas Pleece, who has been able to come along at the last minute. And I thought, as he's a leading expert in this field throughout the world, that it was definitely worth him coming along. So thank you very much for coming along to that. And I think the other person is Dennis Southall, who is Head of Housing Management and Housing Options, as well as Councillor Pavlovic, who is Executive Member for Housing. And I don't know if you're going to join in with the session, Councillor Steels-Walshaw, or you're sitting this one out. But anyway. Okay. So. Go, shall I? Thank you. Yeah,
Thank you.
please.
So I've got the privilege of introducing probably all the items tonight. And this one, it is a privilege that I've been able to be involved in the work of developing the homelessness and rough sleeping strategy. So this is a piece of work that I did get involved in when I first started here. And you might wonder, why is the Corporate Director for Adult Social Care presenting a paper about homelessness? I'll refer you to my previous statement. There's no decision about care that's not also a decision about housing, but also if we're going to fix homelessness, then we all need to be working on fixing it. So there's probably not a director or team in the council that shouldn't have an interest in how we work on this, you know, really complex joint challenge. And indeed, we also need to work with a range of partner organisations and people in York if we're going to get around this. So my role in this work, I've been working alongside Dennis and team and Pauline, and we've had lots of conversations with councillors and others, really ably steered by Councillor Pavlovic, who I'm sure will chip in at some point. And we're really pleased to have Professor Police with us tonight, who very kindly agreed to join our executive steering group, which I chair. So we had the first meeting of that a few weeks ago and had some really effective, really engaged conversations about how we develop the strategy. We've also had a series of workshops that have been set up and run by Andrew Bebbington, who I'm afraid can't join us tonight because I did ask him not to come and share his germs with us. He's unfortunately not very well today. So Andrew's set up lots of workshops and opportunities for a variety, again, of teams within the council, stakeholders, external partners, to hear people's views and to think about how we develop this and go forward. The final thing I'll say is the strategy is really important, and having a really clear vision is really, really important. But what's most important is then what we do with it and what we do about it. So what we want to get on to is taking action and making sure that we can deliver that vision and aims and objectives of the strategy in York as soon as we possibly can. And I'm really pleased to say that there's a huge appetite for that, huge enthusiasm and ambition, and we definitely think that we can make a difference. So I'm really excited. You can probably tell. I think it's a really great piece of work to be engaged around, and we really welcome the committee members' comments and feedback and input at this point, but also, you know, as we go along with continuing to refine that strategy and develop the action plan. So I don't know whether I would just invite my colleagues to add any comments to that first point. Anything, Professor, please?
Yeah, no, thanks, Sarah, for that. I'd absolutely concur about the enthusiasm from the administration down through, you know, all of the teams that work around homelessness. And what I think is very evident is the buy-in corporately around this refreshed strategy. We've seen some tremendous work already, and again, some of the successes are highlighted in the paper that we've had over time. It's about building on those successes and moving at pace towards where we really want to be, which is about, and Nicholas may talk about some of the evidence base that we've incorporated into the work that we do now and the strategy going forward. The feedback from the consultation so far has been really positive. We're putting the consultation documents on the website next week, and there'll be a bit of a press release around that. So anybody can look at those documents and respond to them. And we absolutely encourage everybody to do that. The more feedback we get from as many people and organisations who can, the better. just to reiterate the positivity around this and the positivity of the approach. Over the years, we get people regularly writing to us saying, why don't we adopt the housing first approach? Why don't we adopt the housing first approach? It works in countries abroad, places like Finland. I think the difference we've got here is we don't match the funding regime that places like Finland have provided about this. But what we have got is some great partnership working, which is made all the more stronger by this the group that Sarah is chairing. I think we've been lacking that real strong strategic leadership in the city, and that will help us achieve the long-term goals. You'll have questions around the assets on that we need to deliver this. Again, that's all part of the action plan going forward. We're very good at latching on to, obtaining grant funding for some of the capital and revenue streams that have been evident over this. Hopefully there will be more money going forward at some point, nationally, that we can bid for, and possibly even some more mainstream funding as well. Who knows? However, we've got the resources that we've got. We're very good at maximising the use of that, and the partnership working that we've talked about is key to making sure that all of our systems work together to achieve the aim of making homelessness and rough sleeping rare, brief, and non-recurring.
I'll just introduce.
Oh, okay.
That's the public.
Thank you, and thank you to the officers for their comments. I know how important addressing our homelessness and our rough sleeping situation is in York, as it is across the country, as it is across the world. We know that premature deaths from people who are on the streets means that their life expectancy reduces from around 77 years down to 47 years. That's a 30-year difference if you're on the streets. And I'm even more thrilled to have Professor Police here to talk to you, because and he won't blow his own trumpet, but he will to give you something of his background. He is one of the world's most renowned experts in homelessness and in Housing First, and to have his input into this strategy from day one in developing this has been absolutely invaluable. Every time I've sat with him, every time the officers have sat with him and said, what do we do about this? And he said, Glasgow tried to do something similar in about 1990, and this is what we found. My colleagues have worked on these projects, not just in this country, but overseas. And so, I really do hope you will take the opportunity to pick his brains about the issues that he's found over a very long and distinguished career. So I think I've said enough, bigging you up now.
So I'm bound to be a disappointment now after that. Thank you, Michael. I mean, I suppose just 3 or 4 very quick points, if I may, Chair. So the first thing is I'm here as a representative of the wider university. So the university is very supportive of wider programs around reducing rough sleeping and reducing homelessness in the city. That's in the context of us having long-standing relationships with the national charities. So we do a lot of work with Crisis Shelter, Centrepoint. Over the last few decades, we've also done a lot of work with governments of every colour, both in England at national level, but also working with the Scottish, Welsh and Northern Ireland administrations too. We're also very active at European level. So I'm a member of the European Observatory on Homelessness, which operates under the auspices of FIENSA, which is the European Federation of Homelessness Organisations. And we do a lot of work with outfits like Homeless Link, and we've been involved in a lot of strategic development. The university, in common with other universities, is limping slightly at the minute because the kinds of financial issues that you're encountering, we're encountering. But we do remain very supportive of this at an institutional level. So I've effectively been sent here by the Vice Chancellor to some extent. But we want to engage with this and we want to be very supportive of it. And it's just to register that it's not just me, it's university level interest in this. We've got a lot of shared concerns. We're a part of the city and we want to take an active role in tackling the city's problems. And this is one of the areas where we do have some expertise and some strength. And then, I mean, just a couple of minutes on the strategy, if that's okay, Jeff.
Sure, no, go ahead.
I'm having flashbacks as well because my first ever job was with Northumberland County Council a very, very long time ago. And it's more than 30 years since I sat in front of a local government committee, but it's all very familiar. Three things, I think. The first thing is a housing-led, housing-first approach is one of the few areas of British politics, one of the few areas of European politics, one of the few areas actually going back pre-Trump of American politics where there's very cross-party support. So it's in the Labour manifesto for the most recent election, but it was also Conservative Party policy. So you can find guidance. The last Conservative government supported 3 major pilot programmes because of what the evidence base is. When Housing First was first adopted at federal level in the States, it was under the George W. Bush administration, which was quite a right-leaning administration, which, so there's very, very broad support. There's very, very broad support for 2 main reasons. The first reason is that it ends homelessness amongst people with high and complex needs. So that's where the human dimension is most important. That's where things like health problems, mental illness, addiction are at their most acute. It's also where the greatest cost is for local authorities, for the NHS, for the criminal justice system. And it's that population where Housing First is at its most effective. So the people who turn up at A&E 40 times a year who are homeless, the people who get arrested and processed 40 times a year because they're experiencing long-term homelessness, that's where Housing First is effective. So it ends homelessness. Now, no intervention is perfect, and for Housing First to work, it needs to be properly integrated and supported with other services. It needs to be able to refer up and refer down, but it is very effective. Another reason why it's got very wide support is cost effectiveness. It is cheaper to intervene and stop recurrent and sustained homelessness than it is to allow it to perpetuate. This is also the logic around homelessness prevention. It's exactly the same thing, that the longer homelessness goes on, the more it costs in terms of the impact on individuals, but the more it costs to the public purse, particularly around emergency services, which are the most expensive interventions that we have in society. So it's also something that over time should bring down expenditure and should mean that the use of money around homelessness, around mental health, around addiction, around some elements of repeat offending will become more efficient. That will take some time. You've got a pool of people in the city at the minute who've been homeless for a very long time, or repeatedly homeless. But as Housing First within a preventative strategy is rolled out, those numbers should start to come down. And the other point is, I think that if you look at what's happening in terms of other authorities, comparator authorities, they're exploring very similar kinds of approach. So
the kinds of ideas that are being talked about in this paper are also being talked about in Brighton and Hove, where we've got a project at the minute which has got a lot of similarities with York in terms of like ultra stressed housing market and those kinds of issues. And there's also developments like what's happening with the Greater Manchester Combined Authority in its adoption of Housing First. So those would be the main points I'd make in terms of supporting something like this.
That's great, thank you. I've got a question from Councillor Winston.
Thank you, Chair. One of the things that interests me particularly is that the strategy mentions non-recurring, and I think that is the most difficult thing to do. And one of the key factors, I think, is mental health support in the community. Not just having somebody from Choose sitting on a committee, but actually ongoing support, particularly when a tenancy is acquired. So I wondered if you could just talk to me a little bit, whichever one of you would like to tell me a little bit about how you're going to get a grip on the recurring homelessness that we know happens in the city.
I mean, in terms of mental health support, so apologies, we don't just have people from key organisations on the steering group, lots and lots of frontline operational staff, volunteers, colleagues from across a broad range of organisations have been involved in those workshops. And I joined some of those conversations myself and heard the value of people from different organisations, different sectors, talking about some of the challenges that they know people are experiencing, that they experience as as professionals or people trying to support people to reduce homelessness and to support people with these sorts of challenges that we've described. So again, this is why we're talking about a cross-council, cross-organisation piece of work, because we absolutely need to make sure that we get all of the right ingredients in there in terms of the multidisciplinary approach that we take to supporting people. So thinking through, that somebody could have mental health, they could have a sensory impairment, they might also have had experience of contact with the justice system. That there's lots of multiple issues that people will experience. So we can't just say that's that organisation's responsibility. What are you going to do about that? We need to say, how do we work with that person and that family, and what are we all going to do to it together? So there absolutely will be some specific if you like, groups or individuals where we do need some very specific interventions, and we've been working on identifying ways to support people in terms of, again, thinking through supported housing or supported living and how we work in an integrated way with Tube frontline staff. I think the mental health hubs are a really great opportunity for us to think about how those hubs and the support that's available there can include support with housing issues, support with preventing homelessness, because we've helped somebody manage their money, or think that might be impacted because they've ignored letters or they've just not felt able to deal with things. There's lots of ways, I think, that we can work across those different teams and services. I think the need to involve people at a very strategic level and executive level, as well as the people who are actually doing the doing, is so that we've got that really joined up commitment from all of the organisations and all of the people involved, so we can kind of think through what's everybody's responsibility. And I think some examples where multidisciplinary teams have worked really well together, they have included that range of mental health support, social care, specialists and experts in supporting people with domestic abuse, housing, finance, all those sorts of things. And people will need a bit of some of those things and less of others at different points in time. The important thing is, what does the person need and how do we work to support that, rather than what service or organisation do we direct them to, which I think is probably the gist of your conversation, Carol. Thank you.
Yeah.
I mean, the short answer is this is designed for exactly that population. So that's what Housing First is designed to do, is to work with people whose homelessness is associated with high and complex needs. So the target population and the way in which the model is designed. So the origins of Housing First was based on models that were originally designed to resettle patients from psychiatric wards, because it was designed for populations who are experiencing homelessness with very high rates of severe mental illness combined with addiction. So one of the first services that ever opened, which was in London Borough of Camden in 2010, I saw that house people in their 40s who had never had a tenancy. They'd been in one institution after another for their whole life. They'd never actually held a tenancy. So they're not, they were homeless, but they'd never actually been made homeless because they never had a home to begin with. So it's designed precisely for that population. And it is a multi-agency, multi-level model is the way it's supposed to work. So it should address that concern if it's implemented in the way that's being talked about.
Thank you, and yeah, and you may recall, because you said you were the exec member when it was set up. We already do a mental health housing first approach, and we also have Making Every Adult Matter, which is for those individuals with multiple and complex needs. And this is, if you like, an extension of that. And on page 51 of your papers, it just outlines some of the multidisciplinary team participants. So, for example, clinical psychologists, trauma specialists, substance misuse workers, occupational therapy, employment support and skills, amongst others. And when Dennis and Sarah sort of talked about the buy-in from a range of partners, that's one of the things that I think has been A, very different, but B, incredibly encouraging, that we've come together both from a multi-agency and a multidisciplinary within the council approach to deliver this multidisciplinary hub.
Supplementary.
Yeah. A short one, I hope. Because I'm out of the loop in a way now, I don't know if the skills program is going in. We used to put small grants in to help people with life skills, managing money, how to apply for a job in places like Peace Home. Is that still going in? Because for me, that's really important. You can't stick somebody in a tenancy and then expect them to know how to manage that tenancy without some help and support and education.
Yeah, sorry.
No, I just want to basically say it.
Yes. So I'll talk around this for a bit. So that funding, I will say, does actually still exist. But I think when we look at it as part of the Housing First model, which I'm so excited about as well, I will say, which is about people's needs being met where they need to be met, and looking at what skills and things people already have in place. I absolutely agree that is an invaluable source. But I think it probably needs to be targeted to people who need to do it. Like if we're looking at a Housing First approach and we know that somebody is already able to do something on that list, which comes down to the support. Again, it comes down to having the adequate support for everyone. If we're looking at really complex people, when the representation rate is into its 40%, absolutely people within that very possibly do need some work around. But also I would say within that there's issues around, as you mentioned before, the mental health stuff, addressing. If somebody's incredibly traumatized, I think there's probably some work needs to be done first on mental health, trauma stuff, before some of the other stuff can be put in place. And I think that's where the Housing First model is really, really effective, because it will look at what support somebody needs and what will help them move forward into sustained, healthier lives when we're looking, as we were saying, at the life expectancy of people. So yeah. But yeah, in short, yes.
Thank you. That's okay. Thank you for the question. Councillor Whitcroft.
Yes, thanks, Chair. Just a supplementary on this issue of high and complex needs and mental health, just around the numbers. I can see on page 41, there's a breakdown of homelessness by cause. Any one of those issues could also include high and complex needs. Is there any sort of number or proportion that you could tell the committee about how addiction and mental, how much of homelessness is caused by the issues around addiction and mental health, just so we can understand the sort of the cause breakdown further? Thank you.
I can try and answer that. I mean, if you've got 3 or 4 hours, but I can try and do it in 30 seconds. So most homelessness at any one point in the UK is associated with 3 things. So destitution and poverty is the major driver. So when homeless charities sometimes say homelessness can happen to everybody, it doesn't really happen to poor people. And that's what all the data show us. The second driver is relationship breakdown, and within relationship breakdown, domestic abuse. So at any one point in this city, at any one point in most cities and nationally, the bulk of statutory homeless people, people in the statutory homeless system, are families with dependent children. The bulk of those families are headed by women. So there are far more of those people. So at any one point in England, there are about 150,000 kids in temporary accommodation under local authority duties, which is nationally costing us about 2.2 billion a year at the minute. Most of that expenditure is in London. But several thousand people sleeping rough. So when we think of who's homeless and you think of a lone bloke on the street in a shelter, that's not most of it. That's the most visible bit, literally the tip of the iceberg. Now, most of the research in the UK in comparable economies suggests about 10 to 20% of the population is this high cost, high risk group. They're very visible. They're very, very expensive because they don't tend to exit homelessness with existing services. So they're the people who get stuck in systems, are the people who are recurrent and long-term homeless. And as their homelessness persists, both the human costs and the financial costs. When we talk about the people who live 30 years less than the general population, that's actually what we're talking about. And they have terrible health, terrible outcomes and so on. So it's the majority of homelessness is poverty. There is a small subgroup that's where the really, really high human costs and financial costs are. That's what Housing First is targeted on. The thing about that group from a local authority perspective is, so say you've got a hostel and your hostel has 10 beds in it, and then you've got those 10 beds for every night of the year, so 365 nights per bed. What the evidence shows us, not just in England but across the world, is that those bed nights, that measure, those are accounted for, the bulk of those bed nights are accounted for by that 10 to 20%. There's people who don't.
Bear with me because I've got impaired hearing. I'm getting it translated into text, but the text didn't know what you said. Right, try again. I'll tell you where we got up to. You've got accounting for the bulk of those is what?
Is 10 to 20% of the population, because they don't leave the hostels or they repeatedly visit.
They get stuck.
They get stuck.
Yeah. Mm.
You have a bigger population that go through the hostels and get resettled or self-exit from homelessness. But they're not visible because they're not homeless for as long. It's this small group that's repeatedly homeless with complex needs, high cost, high risk, high cost in human terms, high cost in financial terms. That's what Housing First targets. So if you use Housing First in York, it should free up other resources, because it's a situation where, in terms of your other homelessness provision and cost to the NHS and cost to criminal justice and to other systems like mental health, it's a relatively small group. Another thing about Housing First is your target population is not massive. And that's one of the things that makes it workable.
Yeah. Thank you, Chair.
Thank you. Councillor Pavlovic.
And so to answer both Councillor Whitcroft's question and Councillor Runciman's supplementary, is that's where rapid rehousing as well as housing first comes in. So for those individuals that when there've been two snapshots done, one in 2022, one in 2024, both identified similar kind of traits, that 70% of people were able to live in a tenancy with a minimal or lesser extent of floating support, but yet are still predominantly in tier 1 hostel accommodation. And that's where the expense, if you like, of having incredibly expensive 24-hour, 7 days a week service delivery for people who don't necessarily need that level of support. And one of the things that I actually was surprised to hear when we've been talking with the professor and with the university about the research is the longer you keep people who have not significant needs going in, for example, destitution or family breakdown, and you put them into high and complex needs environments, they then develop high and complex needs themselves within a relatively short space of time. And then you are at risk of having them as a more expensive, more needing of support further down. So it's when we talk about it being rapid and non-recurring, that's where the brief element of the rare, brief and non-recurring element comes in. Triage, identify needs, move into the right pathway as quickly as you possibly can. Is that okay? Yeah.
Good. Dennis.
Yeah, just very briefly, that bears out in reality. All of the what's been said is how things operate. The figures are borne out in the table we put in there with the extensive research we did a couple of years ago. What you tend to do is re-traumatise people, get them into poor behaviours, get them stuck into addictive cycles, and it's not good, essentially. So absolutely, some of the rapid rehousing that we've done with people has made a tremendous difference. We've taken people out who we knew as soon as you put them in a hostel environment would be sucked into some of the activities that go around the street culture that exists in any city. But we're not unique in York around that. So we have rapidly rehoused people. We've got limited resources to do that. We've got huge demand for every single property that becomes available. But these are the choices that we need to make with the approach that we've got. And, as I sort of indicated earlier on, ambitious plans about developing the properties that we have available with our housing partners across the city as well. For example, Joseph Roundtree have helped out with our two of our housing first placements. We've done about just short of 60 overall over the last 4 or 5 years, and 37 are still in place and working successfully. And you don't hear about them. That's because it works.
That's very good to hear. I can be cheeky and just ask a question, because when I was reading through this, I was thinking, how will you avoid people staying in the rapid rehousing longer than 7 to 10 days, as indicated? But you've obviously got other offers of accommodation because of this situation in York where it's very expensive to live in York, to buy, to rent. And there isn't as yet enough social housing. I mean, I know we're doing our best to build as much as possible, but so you've got other partners that you're going to use to rehouse with, yeah. And do they stay in area? Because I think that's also important, is it, to be supported? Yeah.
Yes, so we, you know, we need to do more work with our housing partners. We've also got a great private rented sector team, and believe it or not, we get people placed into the private rented sector in York. Some, you know, people with who have support issues, and the team support the landlords as well as the people moving into the property. So because, yeah, landlords tend not to be experts in dealing with you know, people who are not straightforward, pay the rent week in, week out. With the rapid rehousing, we use stop gaps. So, you know, we will use bed and breakfast sometimes to place people in on a very temporary basis, because that's a better place for them than being in a hostile environment. And you know, one of the things we do really well, I think, is look at the individual and try and find solutions for them within the means that we've got. And again, there's some great working across the teams, the mental health social work team, and other partners as well, to support people, identify any safeguarding issues, deal with those, stabilize people as quickly as possible, and get them on that route through. But we want to do that as the routine. It's sort of a little bit the exception at the moment, because our emphasis is on the hostel accommodation and that approach.
Yeah, thank you for that. Sorry to have jumped in. Councillor Taylor, you're next.
Thanks, Chair. I think I'd like to open by saying that this is, it feels refreshing. It feels like a necessary fresh start, and I really welcome it, especially the amount of what seems like genuine partnership working that's bedded into it. So hats off to all involved. I have two questions, Chair. They sort of relate, so I'll do them together. I'm looking at sections 54 and 55 in the paper. So it talks about how all of this is in alignment with the University of York research. And the next section says that resourcing and capacity will present a challenge to operationalising the strategies presented in that research. So my first question, and I'll go straight into the second one, and I'll let you, whoever wants to answer them both. My first question is, how much are we overlapping with what's in that paper and what we can do operationally? Because we often, in local government, we have strategies and we have the reality, and the strategies are often far off aspirations, unfortunately, due to resource pressure. So I'm interested in how much we overlap with what's in the research in practice, and which leads to my second question, which is, let's say 2 or 3 years from now, how would the experience of a 30-something with unknown health, mental, physical health needs differ, who at 3 p.m. on a Friday realizes they're going to be on the streets and needs help? How would their experience differ in 3 years' time to maybe what they go through now? For instance, might they be seen by someone in person to assess the situation, or would it be over the phone? I'm just interested in what's going to change on the ground. Are they fair enough questions?
You want me to, well, you talk about the research and the paper.
So, yeah, I suppose two things about the research. Yes, I mean, I did work for the Finnish government reviewing their homelessness strategy. There's some very good ideas in it. Transferring it to the British context, no, there's just not the level of resource. But I mean, the same thing if you looked at something like the French housing first strategy, which is again a very large amount of expenditure compared to the kinds of money that we've seen here. But there's a lot of European countries that are very similar to us. So some of the things I've worked with, one of the things I've worked with is Housing First Italia, and they've just got no money. I mean, you know, it's one of those experiences that you sometimes have when you look at other European countries, you kind of think that we've got no money, but then you encounter people that really haven't got any money. One of the things about Housing First is it's more an ethos, it's more a operational framework than it is a particular set of commitments around spending. So it's about working together, it's about working collaboratively, it's about a case management model, but it can be done in ways that are not very cost intensive. So while you will sometimes see stuff describing Housing First as a very high cost intervention, there are other ways of doing it. And the more pertinent experience, I suppose, from York's point of view, is that that's what other authorities have done in terms of their approaches to Housing First. So if you look at what's happening in Housing First in Manchester, it's not a high cost model. And operationally, it costs no more and over time should cost less than existing interventions. So this is about redirection of finance. It's not about increases in expenditure. And that's a kind of key thing. I mean, we need to be careful because as with anything, I mean, if there's a point at which there's a line between streamlining and efficiency and then not having enough money in the system so that it falls apart. We always have to be very careful about that. I mean, that's now a distinctly British policy dilemma. At what point, how much money can we spend to remain operational? So we need to keep an eye on that. But it can be done very economically. So that would be the main point that I'd make.
And just from what will it look like in 3 years' time? The whole point of this is it can't be delivered tomorrow. We can start it, and we can start and over a 3-year period, we should have people off the streets that are more settled, that are not going back into homelessness. And by doing that, the money that we currently spend on our homelessness services is reinvested into how do we best deliver those multi-agency, multidisciplinary support packages. But the good bit about where we are today, if you like, and there is a today, there's a tomorrow, and there's in a year's time approach, is that the buy-in from the sector, both the sectors with the departments within the council, but also outside of the council, are saying this is an issue for us as well, because this is a high cost area for us as well. We will invest, and our investment may well be staff into supporting this initiative. So it's not as though we're having to start from scratch and say, right, we need to find and employ at significant cost a clinical psychologist. We need to find and employ 3 social workers, 5 housing workers, a skills worker, substance misuse workers. We already have those in the system, and they are just going to work in a different and collaborative way with our homelessness and rough sleeping sector colleagues that are already working in that field. Your final question was, in 3 years' time, what is somebody who's presenting as homeless going to find? They're going to find a very tailored, sorry, pardon the pun, approach to their situation, their personal situation. And that's where rapid triaging and allocation into services is going to really make the difference. And Dennis. Sorry.
Yeah, and I would just add, with some of the other work that's going on around the localities model, the community mental health hubs, building on the work people roles that were mentioned earlier, local area coordination. I think what you'll also find is that there is better, wider support, a better model for supporting people in communities as well. I think this is part of a sort of wave of initiatives that we are moving towards rapidly across the council and health. For example, the community rehabilitation initiatives that we're linked into as well. So you will hopefully see people who don't often get into rough sleeping. That's the rare bit. When they do, they can engage with services and we will tailor a package for them, assess them rapidly, and rather than putting them in a hostel for 6-9 months a year, they will be somewhere that will stabilise them for a while, and then we will move them on into their accommodation with the right amount of support around them, and that might, you know, then people might need help around getting back into employment. As we know, some of the homelessness and rough sleeping we experience, and some of the hidden homelessness around, like sofa surfing, is around relationship breakdown or losing a job or something like that. And it can be very, very temporary with the right interventions that we make. And then when people do move on into their homes, whether it's in the private rented sector or in affordable housing, social housing, they live in communities which are connected and where the support is there, and they can walk into it, ideally without appointments and loads of bureaucracy. So if they do go back into crisis, and a flexible system so that it can be there for as long as is needed. Supported housing regimes in the past have been very time limited, and it was a bit of a disaster, to be honest with you. This approach is about it's there for as long as you need it. What we've seen is, and that's why the numbers around the Housing First in particular, 37 is still ongoing. Some people have stepped down from Housing First because they've, with the roof over the head and the right support, they've developed as an individual, they've got into employment, they're able to manage they're able to cater for themselves, etc., etc. So they're just living independently now. That's the difference it can make, and that's what we want to do as the norm, rather than, you know, the limited thing that we do. And absolutely right, you look at the resources that you've got and you convert them into using them much more effectively based on this model. The evidence base is all there. I think it can't happen overnight, because obviously you've got to find places for all those people who are already in the hostels. That's one of the real challenges. And Nicholas again will talk for hours about flow and within homelessness services, and that's what you've got to address.
I suppose one other very quick thing in terms of your interagency, inter-authority relationships, you're pushing at an open door quite a lot of the time, and that's the experience. Because if you talk to North Yorkshire Police about the handful of people in York that they keep arresting, if you talk to mental health services about who is repeatedly sectioned, who keeps having emergency admissions, if you talk to the consultants in A&E about who they see 40 or 50 times a year, and then you talk to the people running Union Terrace, it will be the same guys. That makes a difference in terms of where the dialogue starts, because talk to the district hospital, talk to North Yorkshire Police, so they know who you're talking about, and they've got the same resource issue as you have and the same concerns that you have. And it is part of the reason why there's great interagency potential, and potential for things for you to explore, like cross-commissioning of services over time, is because it's a shared issue, and it's actually, it is quite often the same people. So I think that's another thing to think about in terms of how prepared other agencies are going to be to talk to you about this, because that's been the experience in other local authorities. Nobody's got any money. It's a very difficult situation. Budgets are falling everywhere, but there are nevertheless shared problems, and this is one of them.
Okay, thank you. Councillor Rose, and then Councillor
Thank you. Thank you for this, and thank you for everything you said. It's been really good to hear. A lot of the talk has been about those with complex needs, but I appreciate there's a lot has been said about prevention as well. Looking earlier in the prevention, perhaps than has been discussed this evening, and that really I can't see much of in the strategy, 5-year strategy. That sort of pre-rapids sofa surfing sort of situation. 3 examples that came from social media this week that I saw. One was someone posted into Facebook, they're currently sofa surfing, they've engaged lots of different agencies, they've not been able to get the help they need. And the comments were really supportive. Lots of, I've used this service, it's been really positive for me, naming all the agencies that we've got on this list, and then replying with, I've tried them, they didn't help, I've tried them, they didn't help, all the way down. Second scenario was someone who came in and said, I'm sofa surfing and I'm not sure what to do. And all the comments were negative and said, don't bother trying with any of these agencies. None of them will ever help you. They haven't helped me and I'm in trouble and I don't know what to do either. And they were kind of trapped in the loop, just asking mates if they've got somewhere so they can stay or find the next friend who can put them up for free. And then the third person who's currently staying with their ex doesn't want them there, but hasn't threatened to kick them out. And they don't want to be there, but they can't find another place to go. And they're trying to go through those hoops as well. And we have this across lots of different health and vulnerability services, what I call oh shit services, which is where everybody's fine, they're being monitored, they're not in trouble right now, and then suddenly, oh shit, we need to do everything right this second, rapid response. There isn't much in here about how we support those people in need to stop them from getting further down that perspective. I know there's been some that's been said about the importance of it, but could you give a bit of a flavour for perhaps less about the research where we know this is a useful thing to do, and knowing that the restraints in what we have in terms of finance and the number of houses we've got in the city, and a lot of those people would be people who actually are all right, they just don't have the money for York's crazy high rents. What is our current plan? What does the 5 years look like for those groups of people who are on the verge or at risk of being homeless, who probably aren't even in these bar charts represented on the page?
who wants to take that? Dennis.
Yeah, I think the paper does address some of those issues in the sense that we need to expand the affordable housing supply, and obviously it's an ambition of the administration, and we do have a housing development programme. There needs to be a governmental response around this. As Nicholas has indicated, most of it is around poverty, and you know, short, medium, and long-term access to those affordable housing options. So there needs to be a national response on that. Locally, what we can do, we can provide great advice. We can use, we're talking about better use of information technology and information to filter people and provide them with realistic advice around the housing options. I'm talking to, we've got a really good partnership with Children's Services. So we're talking about taking opportunities to get into schools and colleges, to talk to people about what realistic housing options there are. We need to work better across the partners that we've got, and we're to collect data, and so that we can analyse that hidden homelessness, find it a little bit, just get better at identifying it, because we're not brilliant at that at the moment. There's something called the duty to refer, which is incumbent on all of our partners. So if they believe that somebody is threatened with homelessness, and that could include things like sofa surfing, then they have a duty to refer to this. We need to really, really push that and develop that approach, so that we've got networks available that get into people as early as possible. So there's lots and lots and lots that we can do, which is already embedded in the Homeless Reduction Act, for example, which are our wider housing duties. But there are some, you know, something needs to happen nationally around the people's incomes, and the availability of affordable housing will influence as much of that as we can locally, and we are doing. But I think through the partnerships, the sort of the things that we can do, the networks that we develop, will help us reach those people before they get to that point. I'm a great believer in using the data and sharing information across those partners, because there are obvious indicators which can lead us to provide the right advice, whether it's very light touch or more formal interventions, so that we can help keep a roof over people's head. But you're absolutely right. The options, the one thing we can't do is say, there's a set keys, off you go, there's a council house, you in settled accommodation that's affordable for you. So we really have to work with people through what we call personal housing plans. Again, that's embedded in the legislation. And we go through every single option. And, you know, it may be everything from shared ownership to affordable, you know, discounted home purchase through to, you know, a shared house with the right support and the right advice around what some of these options are going forward.
Very quickly, if I may, Chair, three quick things. I mean, the first thing is, so far we've been asked to help out with housing first, but we can help out with prevention because there's a great big evidence base. And what Wales did in introducing prevention at legislative level in Wales worked a lot better than what England subsequently copied, and because England didn't put enough resource into it. So, I mean, there is an evidence base to draw on, and you can do things about prevention. I mean, a lot of the kinds of issues that you're talking about is because there's not enough money in the system, a lot of tensions in the system. In terms of what's being proposed as a homelessness strategy for the city, so you've got two main areas of expenditure that almost every local authority with a homeless duty has. The first one, which is bankrupting some local authorities or in danger of doing so, is spend on temporary accommodation. Now, because of some strategic thinking and fancy footwork, York has not got itself in that position because it thought strategically and developed the James Street hostel for families. So your expenditure on hotels and bed and breakfast is not going through the roof, which it is for a lot of authorities. So to a considerable extent, you contained one element of homelessness expenditure that's hard to control. The other bit is what we've been talking about, which is the high cost, high risk population. Ultimately, where you want to get to is by reducing the scale and the frequency with which those forms of homelessness are experienced. That potentially creates resource to start doing other stuff. If you're not spending as much money on the people with high and complex needs because your interventions are more effective and that population is being reduced, then you can start thinking about redirecting resources into prevention. Don't want to talk about Finland too much because it isn't a great comparator. Went round a Finnish homeless service one time and they said, there's the sauna as we were going past it. But that's what the Finns did. The Finns got their main area of expenditure under control, which was repeat and sustained homelessness associated with complex needs. As expenditure came down on that, they started investing in prevention. So there are precedents for doing this kind of thing.
Quick supplementary things. Oh, sorry.
Yeah, and I was just thinking about some of the conversation we had at the steering group around the work of the Property Truth Commission. And I think some of the scenarios that we've talked about tonight in terms of examples, actually improving experience for people is not difficult and it's completely free. So if we adopted principles of kindness and listening to people and, you know, taking some time sometimes to just sort of sit a little bit beyond the remit of our roles, like I'm doing today, and think through what would help this person more effectively, I think sometimes that can make a massive difference to people's experience, even if actually sometimes the ultimate outcome isn't that different. I think being there to support people in other ways. So prevention, if we think about what Professor Cleese was describing as the kind of the root causes of homelessness, we're talking about poverty and destitution. There's not massive amounts that we can do to fix that just locally within some services. But there are things that we can do as a council to think through what support is on offer to people, what grants are available, what strategies we develop in terms of affordable housing. We can also lobby, government and partners around you know, things that will have an impact in terms of support for people who are struggling for cash. And, you know, so again, you know, there's obvious links to other programmes. Our domestic abuse partnership, I'd say, is a really effective, engaged partnership. But we know that there's lots more that we can do. And the kind of links between housing and domestic abuse are really strong. I saw a fantastic presentation from our Domestic Alliance and Housing, I'll get it wrong, Domestic Abuse and Housing Alliance lead at the last board. And, you know, there's, again, lots of fantastic work going on in terms of training, support and working with people. So I think we've got to think about those root causes and think about how we work on those as well. And as well as, you know, after this sort of strategy and this particularly focused piece of work, we've got to do some stuff on thinking through the kind of accommodation and support or housing and support strategy more generally. Mentioned Lowfield Plot earlier. Actually, you know, I've definitely got an interest in thinking through where we do need, you know, longer-term support for people with mental health, people with learning disabilities, autism, older adults. Again, have we got the right resources and support and sufficiency of, you know, independent living so that we can reduce restrictive placements and settings, so that we can make sure that we're, you know, spending as little as we need to on supporting those individuals. And again, that frees up capacity and money and resource for other things. So, you know, we absolutely need to be thinking in the prevention space on everything we do from a council perspective. Again, it's really tricky sometimes. I think, you know, years ago, we used to be able to take a pot of money and kind of invest it in a particular area. We kind of just nudge it now. We're nudging things around, but it's still possible. And when we say we've got no money, actually, you know, the council's got a significant budget. Adult social care's got a 45 million net budget. We've actually got quite a lot of money within our control. The important thing is clearly what we do with it and how we spend it. And I think we can do quite a bit of that nudging and quite a bit of that shifting that unlocks, you know, some of the money that we can then spend differently. And if we can do the right thing for people, improve people's experience, get better outcomes, and it might save us money in the long run, it's magic, isn't it? That's absolutely what we should be doing. Absolutely.
Would you mind holding on? Or
I can set up by anyway. Yeah.
okay, Councillor Vassy, thank you very much.
Thank you, Chair. And in a sense, it develops the points being made by Councillor Rose and Councillor Taylor. I was quite surprised not to see reference to age in this strategy as a factor that is of strategic importance. In a sense, relating to what Councillor Rose has just said about sofa surfers, previous strategies have identified teenagers and people in their early 20s as being a specific group with particular vulnerabilities, and keeping them safe and providing safe housing solutions for them was seen as vital, because it was recognised that there were places you could put young people, but you wouldn't put them with that lot of people. So I was a bit surprised not to see reference to age in the strategy. I have a question though. I mean, I would wish the strategy to make explicit reference to that group, is I suppose what I'm saying as a suggestion, because they have particular needs. But my question's for the professor, and I'm really pleased to hear someone at the table who has full of examples of best practice elsewhere. And my question relates to funding and what we can learn from other local authorities in other countries. Specifically, are there other countries and other local authorities where institutional investors get involved in helping to unlock some of the funding to make this work? I'm thinking of local authority pension funds and others. I'm thinking of the way in which certain institutional investors help to renovate buildings to make them more energy efficient. Are they also in other places being used to take, for example, the upper stories of shops in city centres to stop them being empty buildings and make those available to solve these kinds of challenges? So it's basically just wanting to see how best practice elsewhere can help unlock funds that might help move us down more quickly down the path we want to go.
Councillor Papperton.
just answer the first part about young people. There is a young person's homelessness strategy that's been prepared already. I thought it had already gone to children's scrutiny, children and communities scrutiny that Martin Kelly and Councillor Webb and myself put together. But it fits within this strategy that young people, as you quite rightly point out, are a separate and group that really need a specific focus about how best do we keep them within an environment that is supportive, but if they do end up going becoming homeless, it's how best do we support them individually, and whether the interventions that we currently deliver are the right interventions. So that paper has been done, but I'm looking to Dennis, and then we can talk more about, you know, the innovative approaches to increasing your actual accommodation stock.
Thank you, Chair. So yes, the young people's element is already prevalent in the services that we provide. I think I did a paper for Scrutiny, I think it was October last year, and I detailed the existing services quite extensively, and I'd encourage you to have a look at that. Taking that forward, we will apply the rapid rehousing and housing first approach, obviously with the prevention. We do have quite specialised services for 16 to 25-year-olds. We work incredibly closely with children's services who are embedded in that service. In addition to that, we have mature protocols which have been scrutinised by government around care leavers and 16 and 17-year-old homeless young adults as well. So the good foundations are all there with those. Again, we want to take people out of the hostel environment and do that great work in self-contained accommodation where that's appropriate. We are one of the things that we will be doing in the short to medium term is creating alongside our facility at How Hill a building that can be registered under the children's legislation and be part of the registered state for looked after children, so that we can specifically look after children there, because you can be in the homeless services but also be section 20 of the Children's Act and looked after. We can't quite do that at the moment, but that's one of the ambitions. That will be one of the actions in the action plan attached to this. So yes, it's integral to that. We already do that strand, but we will develop the rapid rehousing, housing first, right support approach with lots and lots of prevention going on, particularly around the work that Martin Kelly and his teams are doing around. I forget the terminology around it, but having the right sort of network around young people, keeping them in their family environments where it's like to do so, and looking to develop that approach, which is works with our prevention. It is prevention. So yeah, very much an integral part of the overall picture moving forward.
So I mean, from the evidence base, I mean, the youth homelessness thing, just to say very quickly about that is a challenge around the transition from being a looked after child and that being managed successfully. So I mean, there are various innovations and experiments. I mean, Dennis was talking about, over time, there started to be experiments with a thing called Housing First for Youth, which is designed for care leavers and which is designed to it works in a different way because it's managing the transition to adulthood. And so you wouldn't put them in an adult version of Housing First. And there's also experiments around Housing First for Women, which needs to think about safeguarding in a way that other Housing First services don't. So I think the youth question is a social care, social work and housing challenge because of that very strong association. You know, we know it's the kids who are most likely to have contact with child protection services that are also more likely to experience homelessness as a young person. So I think that's addressing that question. Good practice elsewhere. One of the problems with that is there's all kinds of good practice elsewhere, some of which we can copy, some of which we can't. In terms of private sector involvement, that's a bit of a tricky one. It's hard to generate a profit on homelessness. Nevertheless, it's been tried, and there are experiments out there. There is interest from the private sector, but I think in terms of stuff like Housing First, you're more thinking about community companies, social business, social enterprise type models, where I think it is worth having a look at that and some of those things, because certainly some services either operate on a wholly or partly self-funding basis. And we know that that's been successful in homelessness services more generally. So the best, but also a rather unfortunate example at the minute is Emmaus in France. Emmaus developed a model many years ago, which uses a social business model as part of the response to homelessness. And we've had experiments here. There is an Emmaus UK, which I should stress is separate from the French one. The French one's in a mess at the minute because its founder, Abbé Pierre, has been died many years ago, but has been exposed as doing all sorts of things he shouldn't have done. But the idea remains sound about business involvement and social business models. But yeah, I mean, there's all kinds of ways in which housing can be supplied, all kinds of deals, all kinds of partnerships. Glasgow had very valuable city centre sites with some of its homelessness services on them and sold a couple of them. I've worked with the Simon community in Cork in Ireland. They had a city centre site. Cork is quite like York in terms of very high housing costs and very high land values. What they did was sold their city centre site and reinvested it in alternative services. Yeah, that kind of thing is quite a radical decision, but there is stuff about, well, because with something like Housing First, you don't need the kind of real estate that you do with a fixed site service, then you can start to ask questions about, well, what's that capital doing and could it be redeployed in other ways? You know, I mean, that's a big strategic question for a local authority to ask. But there's also things like, if you have a look on the web for Social Bite up in Scotland, which is a social enterprise, community-led, NGO-led Housing First service. And there are examples across Europe. I mean, one of the interesting things around Housing First in terms of European, but also UK experience is it was the homeless sector that started making noises. Quite often when we see policy change, it comes from government, but it was the other way around. Homeless Link in particular, and later on Crisis in England and the UK, started lobbying for Housing First before it happened. And they were pushing for it and issuing guidance and training long before government eventually decided to invest in pilots. And it's the same thing in Italy. It was the same series of arguments. But yeah, I mean, there's all kinds of different ways that you can do it. I mean, for somewhere like York, exploring stuff like business partnership, exploring the interest of the tourist industry in rough sleeping, I think that's something that you might want to look at as an authority. This is a rich city, and there are, you know, there's big division, and there are these big social problems. But I think certainly Manchester businesses have been talking to the combined authority and the city council in Manchester about how they can support the rough sleeper and the homeless strategy. Yeah. So I think there's potential there, because if you're going to the hotels in the city, you're going to the restaurants, you're going to the business improvement district, all of those kinds of agencies and combinations of things, they've got an interest in not seeing people on the street. Not necessarily for entirely noble reasons, but they don't want people to be on the street. So I think that's something to have a look at. I mean, I would say that there is considerable wealth in this city, and that's something that maybe over time the city council might want to explore through its strategy. Not that I'm writing your strategy for you, because I work for the university, not for you.
I can just quickly respond.
Because I know Councillor Wilson has to go, she'd like to ask a question.
And I'm glad to hear all of that. I spoke at a conference in Richmond, Indiana about 5 or 6 years ago and learnt with my great surprise that they got it big time in America as well. They had city centres where there were shops and the rest of the building was unused. And no one had any mechanism for changing that. They had problem with homelessness and a certain amount of aggression in the city centre in the evening. And one of the key things they decided on, the American Architects Association, was to try and find new ways of encouraging the whole of buildings to be used so that a city centre was alive at night as well as during the day. And it occurred to me that maybe that was something that homelessness and whatever could all be combined to create living city centres rather than places they've become.
There was the initiative living above the shop, wasn't there, in York, actually?
Yeah.
That was started quite a while ago.
I was
So
just
I'd
going
be
to,
happy to hear it.
yeah, I was just going to say that, Chair. We've been talking about that. I remember going to a conference about this self-same thing in 2014. You know, one of the big barriers are that a lot of real estate and city centre real estate in particular is owned by overseas pension funds, and we have tried, and your administration tried the same, to encourage them to make use of their unused space. Without a massive amount of success. But what we are looking at is things like modular house building. That's why we're looking at our existing stock, including our garage stock, for example, to see, you know, can we put some low cost, and there are companies and businesses that want to invest in that type of initiative, including some of the big pension funds, for example, ironically. I'm mindful, Chair, that
Yes, we're getting on a bit, and
you've got a long agenda.
yes, Councillor Wilson.
Thanks, Chair, and yeah, welcome the very positive report. One of the things that I wondered about, having been out with the navigators and seen how effective their person-centred work is, just on the way that they are welcomed by the homeless community when we were out and about doing the rounds, which was brilliant to see, was what happens before, or apologies, I don't know the Housing First strategy particularly well, but the kind of come indoors aspect. The navigator who showed me around was talking about how it's really hard to get those really hard to reach homeless population to trust them. And once they trust them, then you can do lots of this work. And I didn't know whether the hub that you were talking about in terms of dentistry and access to medical services would also have some sort of element of it being like a first stop place where you can start building those relationships with those hard to reach groups before they're quite ready to fully engage. So you've got, does that happen already, or is that part of the plan?
Yeah, so, for example, there's already Denplan have the big van that comes, the mobile dentist comes to Union Terrace. There's GP provision and nurse provision in two of the hostels already. And that's not just for the people that are actually resident there, it's for anybody that needs to access that healthcare, and that early diagnosis and intervention is absolutely crucial. But one of the reasons why people don't trust is because they've been through the system so many times that they've learned not to trust the authorities, because every time they come in, they end up being back out on the streets again. And that's the cycle that we have to break. And that's the cycle that this is designed to break. That's not saying that, you know, that's saying a roof over your head is a right, not a privilege. And if you start at that principle, then you can start to build those bridges, those very bridges that you're talking about.
Just say very quickly as well, the way Housing First works is it is a kind of one-to-one or one-to-two relationship that's an enduring one. So they have somebody and it's the same person. They're not flipping around between different individuals. They have kind of a key worker and there'll be a backup that will be familiar as well. But it centres on building a relationship and then maintaining that relationship. So like Dennis was saying about it being open-ended on that basis. One of the things when it was first introduced in the States was they had to overcome disbelief about what it was offering and how it was going to work compared to some of the services that other people that they experienced before. So they had to kind of say, no, really, we will stay with you. Really, we will get you into housing, and that kind of thing. So I think it addresses a lot of the kind of, I mean, it's like the experience, the other council was talking about the kind of social media experience of kind of being chopped between agencies. If Housing First is working well, it doesn't work like that. And there's this consistency of contact. It's also relatively intense compared to a lot of other services. So there is the chance to build up a relationship because the workers have a caseload of a few people, not 40 people.
Anyone? Sorry, Dennis. We've got one last question. Sorry.
So that in part of the model is about building a relationship. So if somebody's on the field, you have to be able to move rapidly. So when somebody is willing to engage properly with service and get into services, you need to be able to move incredibly quickly to seize that moment because it can disappear very quickly. And that's our experience on some of the Housing First that we've done. And use some of the flexibility. So Ray, I mentioned bed and breakfast earlier on, because obviously we don't have one of these waiting for people to move into. And the expanded model will help us deliver that approach as well. And I think that builds confidence in the relationship. And you know, people talk to each other a lot. And you know, we have great links with care centres and places like that. That's almost like you know, the mini hub where a lot of that work goes on, and you know, I could tell you loads and loads of stories, which I won't do. But yeah, I just wanted to make that point.
That's right. Councillor Steels-Waterall.
I'll be really brief. So it was something that Dennis said about it being for as long as people need it. So it's about meeting people where they're at and working with them. So many of these people who we've been speaking about have been representations, and we've seen it working in the sector, who have been representing to services so many times. So it's really important about building relationships. A lot of those relationships are already there, and it's about the offer, the evidence-based offer that we can give people, and working with people to not re-traumatise them within a system that they may have been around several times, but really looking and discussing this new evidence-based approach.
Thank you very much. Councillor Hook, I think you're going to be the last person to ask us a question tonight.
Yeah, which might be a bit sad because it's probably a bit of a downer. I mean, I really love this and I love how everyone's excited, and I think you're justifiably proud of it when you're telling me on Monday. So I think this is good stuff. The only big worry that I have is that you're saying that we've got to put the money in now and it will have reap benefits and then we'll be able to afford to do other things. What worries me is that that time, if the black hole hasn't disappeared, that money will get siphoned off to somewhere else where we've got a budget shortfall, and you won't be able to do all the good stuff that you want to do in the second round, as it were.
Councillor Pavlovich.
It's an administration priority. Ending homelessness is something this administration is committed to. So we will support it in every way that we possibly can. We can't magic up lots more one-bedroom flats, for example, which is why it's going to be an approach that we'll take. It's a 5-year strategy. But by the end of it, each year you will see improvements and you will see outcomes, and we'll be able to bring them to scrutiny, so that you can see that the commitment remains, as long as we're in administration. 2, that it is delivering the services that we said it was going to, and then you're going to be able to evaluate whether it's successful or not. But where we're currently spending over £1 million a year on our homelessness services, reprofiling how that £1 million a year is spent is how we're going to be able to deliver. You know, if we move away from hostel accommodation into independent living, what do we do with the hostels? That opens up new vistas and new opportunities.
Oh, it's good to hear.
Thank you.
There's some, yes, I've just got lists and lists of things here that's come out of this meeting that I'm sure James is diligently typing away, and that will be able to offer you. And I just think it's been fascinating, and it's really exciting that this is an offer, and I can see that, you know, strategies that were implemented with the good intentions originally, they've been now developed with users' experience, and it's just exciting that this is going to be happening, and that the sooner we can get all these properties built for people, the better, because it is a national disgrace that so many people are without a home, or an affordable home, and are paying an absolute fortune. So thanks everybody very much for some really constructive discussion this evening. Thank you very much for coming, Professor Place. Thank you. And I think we will now definitely have a short toilet break till just 8 o'clock.
Can I apologies, but since the meeting was scheduled until 8 p.m, I'm afraid that's the time that I budgeted for, as I believe did Michael. So that's what I've got in my calendar. So I don't think we're going to be able to stay really any later in terms of the items. So we've just got about 7 minutes left in the agenda for the 2 adult social care items this evening. What would you like to do, Chair?
I don't know. Does anyone need to go to the loo? I know people have been popping out.
We can wait 7 minutes.
We can wait 7 minutes. Okay. Thank you very much. Thank you. Goodbye. Okay, we shall. Yes, we shall.
Can we put it into January?
What this?
Yes.
Well,
Because
I
we've got
was
nothing in-
wondering that, because I think we've
I mean,
we've
it's
had
all
a
very
very
keeping Michael
intense-
here half the
Yeah,
night,
oh my
but
goodness.
It was interesting, wasn't it? Lovely.
we want to give him a proper run.
I'm so sorry.
That's it.
Yes, I must admit, it had run through my mind that it might be an idea to put it into another meeting, but I didn't dare suggest that. So I'm glad you did.
Well, the only thing I'd say is that the options for the next item on the agenda are between us doing something between now and January or not. So it's worth having a decision on that, because it's about how we are engaged for the next couple of months.
Well, can I just Councillor Steele's Walshaw and Sarah's story about this. How would you feel if we shelved this agenda item? Would you prefer us to go ahead with it?
I mean, again, so Michael sat really patiently. So
I know.
if we could just perhaps spare him just a couple of minutes in a moment to speak. But I think, given that the committee has received the previous quite substantial item on the adult social care strategy, we heard gratefully received very constructive feedback, and we're bringing back quite a short item just to, you know,
Okay.
update you. I'm very happy if you want to read that outside of the meeting and provide any questions or comments on that item. And in terms of the peer review, you know, there will be multiple opportunities, I think, for us to return with conversations about preparation for assurance. But really, the items are linked in that, you know, what we're doing as a response to the peer review is developing the strategy in those other items. So if you're happy for us to ask Michael just to give us a couple of minutes just to set the
Certainly,
scene,
yes.
and then, yeah.
I think given that we're all here.
Is that okay?
Those are.
Great, thank you.
So very, very briefly then.
4 minutes.
In 4 minutes, so we'll come back. It's the strategy on a page. Some of the feedback has been, you know, in order to get things more punchy, we can see what it is that we're doing. Actually, a strategy on a page is a really useful thing to do. We've got some new things which are in there, particularly around the priorities. So it's a focus on priorities which wasn't there before, and that reflects the very practical things which the department's doing. And also co-production is strengthened in the strategy on a page, so that features in most of the items within that. And also what you've got there is it's an 8-week plan around developing that in a very, you know, more formal way, engaging with people through a variety of means, so through questionnaires on the web, through some focus groups, some bigger sessions, and then the ability to bring that back and then represent that. I think the bit for the committee here is we absolutely want the committee here to be able to feed that in, and then, you know, there's a kind of an option before we kind of sign it off to come back and say, you know, after the co-design bit, what do you think of this? Or you can have us do the co-design bit, do the kind of sign off, and then, you know, that's it. So it's really whether you want another bite at the cherry, I guess.
Just from my own reading of the document, and one thing that I know from my other work is that digital exclusion and inclusion are a problem. And I'm worried that, you know, you've got a lot of online tools for effective feedback and comments, and I can see you doing one-to-one interviews as well. But how will you really ensure that you get in touch with those people who are digitally excluded?
Yeah, so I think there's a number of issues there. So the online bit, so we're due to be online now, but we're doing some checking of the questions to make sure they're accessible, making sure we have easy read versions of them, and also doing some BSL video stuff as well. So the things which will go online will be as accessible as possible. And then in terms of the other elements of that, the conversations and the focus groups, there's plans around those so that those are with people who are with lived experience and, you know, often aren't able to get to us to have the conversations. So people with learning disability and support living settings, having some conversations with people who are living in residential care. So actually we get the voice of not just the wider citizenry, but actually people who are really at the, you know, experiencing what it's like in terms of adult social care. So there is those different methods hopefully will hit those different points.
And maybe the Age UK groups that are reforming. You know, there might be a great place for you to go and ask in those places.
Yeah, absolutely. And so we've done some work with partners already, including Age UK, who on our behalf are putting out this strategy. And likewise with people like the Carers Centre, who are already sending some feedback around that as well. So
St Sampson's Centre, I know we did a lot of work with them through the Blue Badge Band, so because they were very involved in that. I did Councillor Rose and then Councillor Vesey.
Thank you, and thank you for this. And just to try and cut to the heart of the matter, sorry, thank you very much. Just to cut to the heart of it, The timeline in the annex talks about run through to sort of 15th of November for strategy completion. I'm a big advocate of option one out of the two, which is us having an update and being part of that sort of end of co-design pre-finalization strategy bit. What does that look like in terms of timeline and how we engage given the timescale?
So the timeline, I think, as you say in the paper, is flexible. I think we'd rather get this right rather than, you know, quick. So we put that at week, but actually it is flexible, and we're already experiencing the need to flex a bit around that because of you know, some of the accessibility issues which you know, are raised here as well. So I think that's, you know, we can certainly do that.
I guess more specifically, if we flex the co-design option one option, that comes in January's meeting, that pushes strategy completion out to February. That's from 8 weeks to, you know, triple that. So that feels uncomfortable to me, and I feel like we would have to be an offline engagement if we want to do option one with a January come back for post end of strategy.
So I think that sounds right. I think we're probably going to have to do that in between the formal committee meetings, and we can work out a means of doing that with the chair, I'm sure.
Yeah, can I advocate that, and whether we do task and finish or we do email involvement or something else, I leave that to chair, vice chair.
Email involvement of all of us would be a good way of dealing with this personally. And then, yeah, because we have all got a lot to feed into this. Councillor Vassy, you were next, sorry.
Just to echo what you said earlier, Chair, and I think you've responded positively to it. When I looked at the strategy, the key thing that leapt out of me is how do you consult over and over and over again at these meetings? We go around the circle trying to work out how you reach the people who actually use services. And what I learned, to go back to my experience of this year where I've been dealing with my father who's at the end of his life, is that people in those circumstances meet very few other people. And the only times they meet people are when the social worker comes, when Be Independent's there, when a community nurse revisits, or Helping Hands, or if they're lucky enough to go to a York Age UK meeting. So whatever model it is we have, I hope that we find people where they are. And I note that I was told today, and I'm sorry to bang on about Age UK all the time, but it's been on my mind a lot for obvious reasons. 70% of Age UK day club users said that attending that club was the only contact they had outside their immediate carers from 1 week to the next. And I know we all appreciate that they're a vulnerable group. I just hope we find a method of hearing not just their voices, all those other people who we know need to be inputting into this, and that we don't rely on I see it, I understand the mechanism, but the focus groups and the things like that, to me, too easily become the usual suspects, become people we're easy at talking to, we're familiar with getting feedback from, and what's critical are those other voices that are not heard. So that's my only comment on what I've read.
I appreciate that, and I think, you know, it's yeah, it's a welcome comment and something which we need to be mindful of as we do that engagement and co-design.
Thank you.
Could I just ask who's actually doing the consultation? Is it a council in-house council consultation?
So it's a combination of officers and a partner, which is a national development team for improvement, who work with us around a number of things across adults and children, and have some expertise around co-design and co-production.
Yeah.
Can I just ask if, because you're the people who are the coalface, you know what can be done, what can't be done. Would it be possible to work with community nurses, to work with the social workers, to give them a questionnaire to go through personally with people when they go to visit them? Is that something that can be done?
So that's one of the things which we're doing already that we have. feedback in terms of our social work staff, and that certainly can be incorporated in there. It's I think it's so in terms of the specific questions which we're asking around the strategy, I could take that back as a suggestion and see how feasible that is within the process which we've designed. That's really helpful.
Poppleton's got its own Poppleton Luncheon Club, which is an in-house thing formed with a little bit of War Committee grant. And that would be a good place because it's like the Age UK thing, but we do it ourselves.
Yeah, James is making a note of that, I think, so we can pass that on to you. Are there any other questions or suggestions? No. Well, we've gone over 8 o'clock just a little bit, but I'm sorry that we've overrun with the other item, but it was very, very interesting and very intense. Do you feel okay about how much we've covered?
I think that's fine, and I think probably we found it really helpful to be here for the conversation around the homelessness strategy as well as the other items. So very happy for committee members to send us any email questions, comments, any feedback, any suggestions about other ways to engage, and we'll definitely respond to those. Again, as quickly as we can, really. So thanks very much for everyone's time tonight. Really appreciate it.
Oh, thank you, and for your time and your enthusiasm and passion for the work that you're doing. I think we're very lucky to have you. So thank you. Right, okay, so the work plan. I'm not going to go through the work plan now. You'll be very pleased to, apart from.
Well, we're skipping over the CQC prep adult social care peer review. Is that coming back to the future or not? I don't think it needs to, because the actual action on here is just to note it.
A minute, what's the
agenda item 7, which we haven't discussed? It hasn't been presented. I don't think it needs to be presented.
That's right, yes.
It was the previous one. I think that was, well, at the very least, I've read it all the way through and I didn't have anything of burning urgency, and I'm happy to note it if we want to just close it up as an item rather than bring it back, that's all.
In my weariness, I've melted that into one item, and it's actually 2, yes. The adult social care peer review. I thought it was, happy to note it. Yeah. Okay, good. The work plan, okay, certainly.
I understand why it's done, but the report talked about strengths and then talked about for consideration. And I understand why that's done. But the point of this is to be self-critical. And I did find myself thinking it would be more honest to have the word strengths and then weaknesses, and then to properly rehearse them and not try to pretend there aren't weaknesses. It doesn't matter who the administration, it doesn't matter what local authority it is, there are always strengths and weaknesses. So that was my only comment.
Convention is the way you do it.
Yeah.
Having done them myself.
You'd go for strengths and weaknesses,
Strengths and consideration.
Okay.
Yeah.
Okay.
Yeah, I mean, to echo the reason as for consideration is that some of them aren't weaknesses, some of them are things we do quite well, but we could still do better. I actually think the final bullet point on that was a really good summary. I really like the phrasing of it. Focus on the fundamentals does not mean delaying impact on outcomes and finances, but becoming simpler and building the strengths and motivations. And actually, I think across the council, that's a really critical thing for us, is when we're struggling with finances, it's really easy just to push things into next year, or to go, well, if we don't spend that, then it won't have a massive impact, but actually we're not improving things, we're not making things more efficient. And there's a lot of other good stuff in the report, but I think for me, a lot of it was, if our weakness is anything, our weakness is finance, how do we make sure that when we're cutting, we're not impacting outcomes, we are just finding ways of making things more efficient. But I echo that. I think we should be more clear as to which things we're weak at and which things could be tweaked, but we're actually not bad at.
And the thing about the self-funding and funding disputes, I think that goes on in every authority, with every, I mean, I know from my own experience, and it's utterly tragic and awful. So Yeah. If we think of any other recommendations or then please email. The work plan I'm not going to go over now. Any urgent business?
Well, it's the work plan that I had comments on, not least because we have January blank on there. So it's
Sure, it won't
definitely,
remain blank.
it's definitely worth noting the thing we just said right then, which is from a work plan perspective, bringing back the ASC strategy when it's complete in January's meeting after all the other work we're doing. I also just wanted to note, it says neurodivergence strategy twice. It should be neurodiversity strategy twice. The difference is neurodivergence is the people who aren't neurotypical. Neurodiversity includes everybody. So actually, calling it the neurodiversity strategy is the right phrase. That was all.
Very good. Thank you for that. Any urgent business? No. I'll bring the meeting to a close and thank you all for your patience and yeah, your input. I think it was an absolutely fascinating meeting. Again. Yes,